I'm not anti-supplement. I just think that we need to take a step back and look at what are we using them for and what are we hoping to gain out of it. About 6 months ago, part of the Nurses' Health Study released a statement. Did anybody see what that statement said about multivitamins? It was a little bit depressing, in fact. It said that, and it actually suggested that physicians stop recommending multivitamins because what the study showed, and the Nurses' Health Study is thousands and thousands and thousands of people followed over many years of time. It was showing that there was no beneficial effect whatsoever of a multivitamin in disease prevention. The people who were taking the multivitamins regularly were not having any better outcomes than the people who weren't. Because I've always said a multivitamin is not harmful. It'll if you are missing a nutrient, it'll help make that up. So in light of that, what I would say about those types of cereals, I don't think they're harmful. I'm just not sure that they're very helpful either. We'd like to think if we didn't eat a perfect diet that eating a cereal like that could make up for it, but it's just not panning out that way right now. Mm-hmm. Well, I think it has to be very individual. I can't give one answer to everybody in the room about this. I think it involves sitting down with somebody who really understands supplements and getting a good history of what your needs are. Some people need to be taking an omega-3 supplement because they may have a very strong family disease history, and that's going to be protective for them. Other people may not need to be doing that. So, right. And I think what we're finding is that it's very difficult to make population-wide recommendations for supplements because we all have slightly different stories, different histories. I mean, you can categorize things and say somebody whose mother and father both died of heart disease in their 50s needs to be taking steps to protect themselves, extraordinary steps to protect themselves against heart disease beyond just eating the right type of fat. For certain nutrients, I mean, your physician can certainly test for things like B vitamins. They can test for symptoms like anemia when you have deficiencies of things like folate or iron. But as far as like just a general panel, you can test blood calcium levels. That doesn't always tell you what your bone health is like. I mean, there's a gamut of things you can do, but I wouldn't say that there's like one blood work test that you can run that's going to say, okay, here's everything you're deficient in. You just kind of have to chip away at it.